My oldest is 21, and I can still remember our first nights at home. When he would have to feed, both my wife and I would both get up. And after like a couple of days, we were like, this is probably not right. So we divvied up the night. Whatever happened during that time was yours. Yeah. You could not call off. Whatever happened, happened.
Welcome to the Kids Health Uncomplicated podcast, an official podcast of Cincinnati Children's. Today's episode is part of a series focused on topics about being a new parent. It's my pleasure to introduce you to our host, Dr. Patty Manning. Hi, Patty.
Hi, Kyle.
So, Patty, you've had kids, you've had grandkids, and you've seen thousands of newborns in your career. Be honest, did any of your babies actually sleep?
The first one, no. The first one did not sleep. He was very challenging, and that's probably a combination of factors, but he was not a good sleeper. Our second one was an amazing sleeper. And then by the time we got to number 3, she gets the gold medal. She was on the top of the podium for sleep.
What's something you used to tell parents in the office that you then completely forgot at 3 a.m.?
Oh my gosh. I would tell parents that they're going to have to settle themselves and let them cry a little bit. And that is incredibly hard. It's easy advice to give. It's hard advice to take. And it's nuanced advice, right? Because you don't want to let somebody cry too long, but they do have to learn to settle themselves. So not rocking your baby completely to sleep and trying to put them down completely asleep it's important. It's really, really hard to do. So it's a good thing to learn in real time as a pediatrician that, hey, you're asking people to do something that's pretty hard.
Which is a perfect intro to our guest, and I'll let you intro him.
So we're excited today to have a person who I know well, who's a general pediatrician, talk about a topic that I think is so important for new parents to feel comfortable about, and that's sleep and feeding. So welcome to Newborn Sleep and Feeding Uncomplicated. Hi, everybody. I'm Dr. Patty Manning, and I'd like to welcome you to Kids Health Uncomplicated. Today, we're talking about newborn sleep and feeding. And I could not think of a better person to go at this topic with than a good friend and colleague, Dr. DeBlasio. He's a general pediatrician here at Cincinnati Children's. He also happens to play an important leadership role in our residency training program. So not only does he work with patients and families, but he helps teach our next generation of pediatricians. So welcome, Nick. Happy to have you here.
Thank you. It's always a treat to team up with you and see my good friend.
Yes, it is. It's fun to do this work together. So this topic of the newborn period, I can't think of a more anxiety-provoking time for parents. It is really just, I think, the hardest time. And both of us have had kids, and we know what that first few days, weeks, and months felt like. And even as pediatricians that were either in training or we had finished our training, nothing prepared us for that time period.
No.
So I'm curious, just to kick things off, what do you see in the first 90 days that parents get concerned about, but it's actually normal?
First of all, definitely want to echo, it is hard for everybody. I remember telling my parents, I'm a pediatrician, we'll be fine when we go home. And we were home 10 minutes and we're like, you want to come over? So, it is very hard for everybody. So I think just to kind of normalize that it is challenging for everyone. I would say the big things that I really hear a lot about are spitting up and feeding, and then pooping. Everything in pediatrics, we talked a little about this earlier. Everything in pediatrics ultimately comes down to pooping at some point. Everyone wants to make sure that their kid is pooping okay. But I hear a ton, especially those newborn visits, concerns about spitting up, whether it be formula or breast milk, and then also about bowel movements in general.
And spitting up is normal, is what you're saying.
Yes.
Some amount of spitting up is normal. Not, huge volumes or huge degrees, but baby spit up.
Yes, absolutely. And I always tell people what looks like your baby has spit up looks like a ton, but it actually is not that much usually. So spitting up is very normal. And what I typically tell people is spitting up is not typically a medical problem. It's more of a laundry problem in the sense of, every baby is going to have some degree of spit up. We tend to see a little bit more in the babies that are born a little bit early. But what I always tell people is spitting up starts to decrease as babies just get better musculature. And, they're able to kind of not have everything be a little bit so floppy.
Yeah.
But spitting up is very normal. It doesn't mean you need a formula change. It doesn't mean you need, to just alter the feeding schedule, et cetera. The big thing I look for is a baby gaining good weight? And then that to me is a lot of reassurance that the spitting up is pretty normal and that we'll resolve with time. Sometimes it can take months.
Yeah.
But in the beginning, everyone wants to make sure, is the baby getting enough?
So something related to spitting up that you kind of touched on is obviously feeding, and that fear that my baby isn't getting enough, or if they spit up, they just spit up everything they ate. So especially with breastfed babies, but really with any baby, how do you know that they're getting enough?
So the big thing I look for is kind of what goes in comes out. So I'd like to make sure, in general, by the time a baby's about 5 days old, they're having at least 5 wet diapers a day. So that is what I really look for. Is the baby having 5 wet diapers a day? And what are the bowel movements like? And bowel movements can be kind of all over the place as well. A breastfed baby will often poop every time they eat. So sometimes you'll have parents come in for concerns about diarrhea, and it's really just a breastfed baby who's pooping every time that they eat. A formula-fed baby, maybe they're going to poop once a day. So it's just, there's a little bit of variability based on the type of feeding and honestly, just what the kid's GI system is going to do. But urine is pretty consistent. Like a baby should be having, 4 or 5 wet diapers a day.
It kind of leads into that topic that we'll probably touch on in a little bit, and that is how easy and tempting it is to compare your baby to somebody else's baby, and how tricky that is, because as you just said, things can vary significantly across babies depending on how they're fed, what they're fed, and just who they are.
Yes.
So it's a tricky game to get into, but it's a very normal tendency for parents to have. I think a topic that's equally stress-invoking or anxiety-invoking in new parents, maybe even more so than feeding, is sleep.
Yes.
Because not only is the baby not sleeping or sleeping on an irregular schedule, but the parents are sleeping on a very irregular schedule. Again, this was another area where I thought, I'm a pediatric resident. I've stayed up all night. I can handle this. Well, a newborn is that, on steroids because they're up all night, every night, or most of the night. So how do you think about or talk to new parents about sleep and sleep expectations?
First of all, I have to agree 100%. I felt like the same thing. I was like, I'm used to being on call, but then I was like, this is like being on call every night because you're just you're just all, it's just continuous.
Yes.
So what I really try to normalize it. And I think that people want to have good sleepers, but I think people feel like you have to start sleep training like immediately. And my goal is really just babies will often find over the course of a couple months, they'll find their own rhythm and to really kind of, let the baby kind of find his or her own rhythm to kind of start off with. But I really just kind of let people know realistically during those first few months, you're going to be getting that your baby is going to be up every few hours or so to feed throughout the night. The sleep schedule might be a little bit off. You may have a baby who sleeps a little bit more during the day. You may have a baby that sleeps a little bit more during the night. All of that is very normal. So just kind of normalize all of that. A couple tips that I will tell people if question comes up a lot about the baby has his or her days and nights mixed up. And what I will usually tell people is nighttime is, keep things very quiet. I mean, just keep the lights really low, go in, change diapers, feed if you need to. Don't really make, a lot of noise and lights aren't bright. Oh, you're so cute. You're so wonderful. Just go in and just kind of do what you need to do, put the baby back in his or her crib, and then, kind of go about your business. Daytime is playtime. Keep lights bright. There's lots of noise, etc. So that kind of helps a little bit. But most importantly, just give the baby some grace, if you will. He or she's still figuring it out too. This is all very new. One other thing I would always like to mention to parents, though, is it's really nice to split the work. Like if you are in a 2-parent household, or if you are in a household that has, other family members living there, it takes a village, truly. And I think just recognizing that it's okay. Like the first parent could do this feed, and then the second parent could do that feed. Recognizing that it's important to make sure that you're taking care of yourself as well as making sure that the baby is fed.
I'm so glad you touched on that, because I think I can just speak as a mom, the burden that we feel to kind of do it all, to do everything. And there's a lot of help, fortunately, in many families in different forms, and taking that help, I think, is a really important part of just taking care of yourself and being well rested. And but at the same time, those first few months, they're just rough. They're going to be rough.
They're very, I look back on them and you're kind of like, you feel like a survivor.
Yeah.
Like we did it.
Yeah.
And I think, I can still remember my oldest is 21, and I can still remember our first nights at home when he would have to feed, both my wife and I would both get up. And after like a couple of days, we were like, this is probably not right. So we divvied up the night. Like she would take 10 to 3, I would do 3 to 8.
Yeah.
And our role was whatever happened during that time was yours.
Yeah.
You could not call off. Whatever happened, and you were responsible for it. There was feeding, diaper changing, etc. And just knowing, hey, I'm going to get X amount of sleep, was super helpful. Again, we were fortunate to have, 2 parents in the home, but I think you often have friends and family that really do want to help.
Yeah.
So just take advantage of all of that. It is not admitting that you're a failure. It is simply saying parenthood is hard for everybody, and it is all hands on deck when you have a new baby in the house.
It feels interminable during that time period, but you look back and it goes very quickly. And fortunately, we all get through it, and then we go, oh, well, let's have another kid. And fortunately, that second kid tends to be a little easier because it's familiar. But I'm curious if, now that we've talked about sleep and feeding, when does something about one of those areas become a concern to you? Like what would be a red flag that a parent might say or raise a concern with you that you go, yeah, that's probably something we need to check out?
Spitting up is pretty normal. Like every baby's going to have a little bit of spit up. I worry though if there is just like a very forceful spit up, and we're talking literally kind of like flying across the room.
Mm-hmm.
I worry about that. I also worry if the baby is having, spitting up, but also having other problems. They're back arching, things that make you think, could there be something like reflux going on? Mm-hmm. Also, if number wet diapers is trailing off, if the baby's coming in, to have their weight checked and we're not seeing good weight gain, that's a sign to me that maybe there is something going on with the feeding. And kind of on the opposite end of things, I worry if the baby is, having bloody stools. That makes me think maybe there's some part of their formula that isn't agreeing with them, or maybe there's something, in mom's milk that is agreeing with the baby. So I worry if the spit up is forceful, if we're noticing decreased numbers of wet diapers in activities, or if there is an issue with like bloody stools, things like that.
Or weight gain, obviously.
Yes, absolutely.
And
yes.
Is there anything about sleep that gives you pause that a parent would report?
I think it's important to know that babies have a huge range in the amount of hours that they're going to sleep. Some babies will sleep, 19, 20 hours a day. And it is just they wake for feeds and then they go right back down. And those are parents that will often come in and say, I'm so nervous, like she sleeps all day. And I always say, be grateful, because in 2 weeks, you're going to be in here telling me the exact opposite. She's up all night.
Yeah.
So I worry, if a baby is, the first couple of days, all babies are pretty sleepy.
Yeah.
But I worry if a baby is excessively sleepy. I worry if it is, again, just kind of harder to, wake a baby up. But in general, like when babies are sleeping,
let them sleep.
Let them sleep. Absolutely.
It's that famous adage, let the baby sleep. Don't wake up a sleeping baby.
Absolutely.
Kind of related to both of those topics. I feel like new parents are really bombarded, if you will, with tools and resources and apps and things to keep track of stuff. When they ate and when they slept and when how much they ate and just a lot of data tracking. And I had a good friend ask me about that. How important is that? Do you want to see all that data when somebody comes in for a visit? Do you want to print out of all the times and ounces and milliliters and everything?
In a word, no. So the main thing that I want to know is just kind of a general, hey, she is feeding every 2 to 3 hours. This is the amount that she's taking. She's having a good number of wet diapers. And yesterday she pooped twice. I don't need all the specific stuff, because what I worry is every feed's a little bit different. Some feeds are going to be great. Some feeds are not going to be great. I just really kind of want the overall kind of, hey, overall, this is the general amount that she's taking. I do worry, because that newborn period is just a really stressful time. And I think when you add, you track this and track that, it just adds to kind of that level of anxiety and stress, because you just feel like, oh no, this feed was this, but now this feed is a little bit less as far as number of milliliters. And yesterday we had 6 diapers, today we have 5. And I think you can just kind of drive yourself to the point where you can almost make yourself frantic.
Yeah.
But the main thing I want to know is literally, how often are they feeding? How much are they feeding in general?
Right.
And are they making wet and dirty diapers?
Right.
All the specific stuff, I think that it can just be data overload, which is in a brain that's already processing a lot as a new parent, adding an element of data is often just kind of an unnecessary
addition. Yeah.
Yes.
It's more than it's needed. So I think
Yes.
that's super helpful. All right. You've got one piece of advice or reassurance to give new parents of newborns. What would it be?
Number one, it does get a lot better. And I think I can remember people coming to us and saying, this is the best time of your life. And my wife and I were like, it is? This is the best? So I would say just it's okay to embrace that it's really hard.
Yeah.
And I think just acknowledging that, hey, this is really hard. I feel really grateful. I have a baby here, but I'm really struggling. It's really hard. So give yourself a lot of grace that things do get better. And I want to sneak in a couple more tidbits if that's okay.
Sure, of course.
I would also say common sense is really going to prevent you from doing anything bad, if you will. So much of stuff, parents really doubt their intuition and their ability. And I think everyone wants to do right by their kids, and common sense is going to prevent you from doing stuff that is going to be that is going to harm your baby. And to just have confidence in yourself. We're all kind of growing and learning. Ask your pediatrician if there are ways that he or she can help. That's what we're all there to do. And reach out for help, whether it be family members or your your pediatrician, the nurse at the pediatrician office, et cetera. We're all there to help. But it does get better, and just kind of hang in there, because as you said earlier, the time does seem like days, sometimes seem like years, but then all of a sudden you're just kind of at the end and you're like, wow, this is amazing. Everything just flew by.
That flew. Yeah. No, definitely a year out too, when you can look back and go, oh my gosh, I can't believe you were ever that little. I can't believe this is how much you ate. You ate,
yes,
30 cc's or an ounce, and now you're eating a whole plate. But that's great. Such helpful information and advice. And I can't thank you enough for sharing all
my
that.
pleasure.
Nick. We're really appreciative.
The way we like to close all these episodes is with a quick little segment we like to call Myths and Facts. So, Nick, this is how it'll go. I'll throw out some myths, and you can quickly either refute them or you can say, no, that's 100% true.
Okay, sounds great.
Right? So, here's myth one. Your baby should sleep through the night by 2 months.
That's pretty early. So I would say that's a myth. You will have some babies, some bigger babies that can do it. But the majority of babies, I'd say it's closer in that 4 to 6 month range that you're going to start getting some of those longer stretches at night. Your preemie babies are always going to take a little bit longer, just because a baby can only go so long without feeding. But so I would say 2 months, some babies will do it, but that'd be incredibly unusual. I would say closer to 4 to 6 months.
All right, myth two. If your baby's always hungry, you're not feeding enough.
So what I look for as far as I really define kind of what is always hungry. And so if I expect a baby to eat every 2 to 3 hours, and I expect that he or she will be satisfied after a feed. In general, for a baby that's kind of a healthy baby that doesn't have a lot of, fluid restrictions, et cetera, babies let you know when they need more. So sometimes I will ask a parent, I saw you last and, she was taking 2 months or 2 ounces, and they'll say, no, we bumped that up to now she's at 4 ounces. So babies let you know when they will kind of, that bottle's empty and they're looking around like, we're ready. I'm ready for the second course.
Got it.
Yes.
All right. The last one, a sleeping baby is a healthy baby.
So if I think Patty said it earlier, if a baby's sleeping, truly let them sleep. I will say, of course, as with everything in medicine, there's always a caveat. If you have a kid who is, clearly difficult to arouse, or a kid who is ill and is just really, oh my goodness, what's going on? This kid's been asleep for, X number of hours. Those are reasons for concern. But in general, if you have a healthy baby who is, starting to give you longer stretches of sleep at night, take advantage of those, and don't feel like, oh, wow, I should probably go wake this baby because it's been 3 hours. If you have a healthy baby who is giving you longer stretches at night and weight gain looks good as far as take advantage of it.
That was a great conversation that I got to have with Dr. Nick DeBlasio, who's a colleague and a friend, about newborn care, newborn sleep, and feeding uncomplicated. And thank you all for watching. I hope to see you again.